COVID infections are now on the rise, and so are hospitalizations. The positivity rate is now nearly 9%, and hospital beds are filling up fast with sick patients. The majority of those are unvaccinated. Our chief political reporter, Susan Raff, is live at Manchester Memorial Hospital, where doctors, nurses, and staff members are getting a well-deserved thank you, Susan, for working around the clock. What they've done now for 2 years has been remarkable.
It really has been remarkable, and they did get a little thank you today, but this has been a very stressful time, and hospitals are seeing a steady increase in COVID patients. Not quite the full capacity that we saw during the peak of the pandemic, but some hospitals are getting close. And as you mentioned, after a long time, 2 years of this pandemic, it's taking a huge toll on healthcare workers, not just physically, but mentally.
People are burning out fast. I work in the ICU.
Senator Chris Murphy came to thank hospital staff at Manchester Memorial, and he also heard from those who have been working tirelessly. Vaughn Martin is a registered nurse. The pandemic has created stress in the ER and at home.
I have people who are afraid. I have family members who are immunocompromised. So it's not just myself going in to deal with the families, dealing with patients who are COVID positive. Then I have to go home. Just because I have people in my home that are more susceptible than I am, I get undressed in my garage.
We have the power to beat this, and I wish that we would have beaten it already, but I know that we have saved hundreds of thousands of lives in this country because of everything that you have done.
Adding to that stress, a shortage of hospital workers, a record number of job openings.
What can you do to help us hire more staff?
Workers are needed to treat patients physically and mentally.
Mental health is the invisible part of health. And so oftentimes we see the physical toll in life and in mass epidemics.
Our staff don't have a lot for mental health supports, especially those of us in the field.
Emergency rooms are seeing a steady increase in patients who are sick and unvaccinated.
And the reality is when a patient looks at us and say, well, can I get the vaccine now? That's a hard thing for, all of the providers to really discuss with them, because the reality is it's too late.
Doctors say a very important tool, obviously, are vaccines, but so are home testing kits. And we are told the federal government will be making a lot more of those available, which should reduce some of the stress on our emergency rooms. Our healthcare workers are heroes. Keep in mind, they have been working on the front lines for a long time. We are live tonight in Manchester. Susan Raff, Channel 3 Eyewitness News.